Hello everyone, welcome to How to Remember Pharmacodynamics, competitive versus non-competitive antagonist. So before moving on, first we should know what is antagonist. Antagonist is a medication or drug or agent that binds to receptor, so that means it has an affinity and there is no response. When you see in the dose response curve, so here is the antagonist. Antagonist binds to receptor, but there is no response. Whereas full agonist, we have 100% response, partial agonist less than 100% response, whereas inverse agonist decreases the constitutive activity or basal activity of the receptor. So when you see the agonist binding to the catalytic site of the receptor, whereas a competitive inhibitor, competitive antagonist compete for the same binding site in the receptor. So when you see the same thing in the dose response curve, the A is the full agonist, so it produces a response. When you combine with the potentiator, so here you can see the potentiator, so that you see the green that binds to allosteric site that increases the activity of agonist. So when you see the potentiator A plus C, so your graph shifts towards to the y-axis, that is potentiator. So in terms of competitive antagonist, so agonist plus antagonist, so that means here you may get, this is with 10 milligrams of drug A, you put this response. When you maybe you can add 100 milligrams or increase the dose of agonist with the competitive antagonist, you reverses the antagonistic effect, it reaches the maximum efficacy. The only is the ED50 or EC50 or Vmax is uh, increase. So that means the potency is decreased. So that's a competitive antagonism. So by the name itself, there is a competition at the same binding site. Whereas non-competitive, that is allosteric inhibitor, that non-competitive antagonist binding, that is a different site than the active catalytic site of the agonist. So here, if you see the competitive antagonist, so both competitive antagonist and agonist compete for the same binding site of the receptor. Okay, so here this is just similar to Michaelis-Menten enzyme kinetics. So in terms of enzymes, we are putting here as a receptors. Okay, so where we say the Vmax, so here we say maximum efficacy. So ED50 here in the enzyme kinetics, we say Km. Okay, all are same things. Okay, so just recollect your biochemistry, then it is easy to differentiate competitive or non-competitive antagonism. All right, so this is the x-axis dose, the log dose, and y-axis is the maximal effect. So when you give the agonist, so it binds to receptor. By increasing the dose, we are increasing the response. So that is a ceiling effect. When you add competitive antagonist and agonist, so while increasing the agonistic concentration, so this is the curve, this is the agonist plus competitive antagonist. So by increasing the concentration of agonist, so you are removing the, or you are overcome the antagonistic effect of competitive inhibitor. So what is the changing here? So agonist and antagonist, competitive antagonist compete for the same binding site and overcome the inhibitor action by increasing the agonistic concentration and the dose response curve shifting parallelly rightwards. And what is changing? The potency is decreasing. So because you are increasing the concentration to produce this 50% response, correct? So your potency is, how you know the potency is decreasing? Because your dose is require more. So ED50 or Km is increasing, right? So this is the EC50 or ED50 we are looking for. So this is the EC50 or ED50 or Km. And what about the maximal efficacy? So this is the Vmax or maximum efficacy. So that is going to be achieved. So after increasing the agonistic concentration, Vmax is reached. So this is the competitive antagonism. So what's the take-home message? So the competitive antagonist and agonist compete for the same binding site, and competitive antagonism can be overcome by increasing agonistic concentration. And dose response curve shifts rightwards. Potency is decreasing by increasing the Km, and maximum efficacy does not change. So maximum efficacy is achieved by increasing concentration. So same thing here. So you can see this is the Michaelis-Menten equation. So here you can see the maximum efficacy is achieved by the competitive antagonism. Okay. All right. So whereas a non-competitive antagonism, what happens? So because non-competitive antagonist binding other than the active site. So agonistic binding here, catalytic site, and non-competitive allosteric site. That is what this is. There is no competition. That's what non-competition. So that is why whatever you increase the agonistic dose or concentration, you cannot remove this antagonist from the binding. That is what your maximum efficacy cannot achieve. It's whatever your agonistic concentration you're increasing. So this will go like this. Okay. So this the curve is the agonist plus non-competitive antagonist. So, but EC50 or ED50 does not change. The potency does not change in the non-competitive antagonism. So, maximum efficacy is decreased. Vmax is decreased. No change in potency. That is the take-home message from the non-competitive antagonism. So, there are several types of antagonisms. The first one is pharmacological antagonism. So, here both agonist whereas antagonist compete for the same receptor. So example, beta adrenergic receptor. So beta adrenergic receptor, both agonist albuterol and propranolol beta blocker both act on the same receptor. So that is a pharmacological antagonism. Physiological means different receptors, different neurotransmitters. Okay. So that means here acetylcholine causes bradycardia. So that is a parasympathetic. Correct. So acetylcholine act on the muscarinic receptors, bradycardia, whereas norepinephrine produces tachycardia by acting on adrenergic receptors. Norepinephrine acting on so alpha receptors. So opposite actions, different receptors, different neurotransmitters. That's physiological antagonism, right? Whereas a chemical antagonism, so here both agonist binds to directly with the antagonist. That is a chemical antagonism, no receptors. So that means the antagonist form complex with the agonist and reverse the action. For example, protamine is the antagonist for the heparin, is anticoagulant. To reverse the action of heparin, the protamine directly binds to the heparin. So let's apply our knowledge into the clinical cases. So here we have an experimental drug X as an antagonistic property. It found to bind to the same site of the receptor as an agonist. Okay. So here we got some clue whether it is a competitive, non-competitive. If you say same site of the receptors, so you guys know, right? So just pause the video, come up with the correct answer, then we will work with the explanations. All right. I think you got the correct answer, right? So same site means, and also let us dissect a little bit more. The agonist triggers the action potential because we know that agonist binds to receptor, produce a response, right? So when you add antagonist, the response is going to decrease because some receptors binds to antagonist, some receptors binds to agonist. So overall response going to be decreased. So in the by in the presence of experimental drug and agonist could still produce the Emax by doubling its concentration. That means while increasing agonistic concentration, you are overcoming antagonistic property. So the EC50 is increased, potency is decreased. So this is the competitive antagonist. So, so let us discuss the incorrect options. So incorrect options like so we have chemical antagonism. Okay, so we are going to discuss here. So this is the next question. In the following figure, The concentration dependent curves, the phenylephrine. So you have phenylephrine full agonist, that is a full response, and on the y-axis is the response. This is a log dose. So the both alone and in the presence of fixed concentration of drug X. So this is a drug X. So what's going to see here? The maximum efficacy is decreased, right? So whatever you increase, so this is the maximum effect. How about EC50 does not change, right? So based on these two factors, you can easily figure out what is this type of antagonism. I think you got the correct answer. This is a non-competitive antagonism. All right. So this is a not competitive, because if it is a competitive, you may achieve the maximum efficacy, correct? So that is why it is not competitive. And EC50 is going to change with the competitive, right? Where a chemical means, so here the chemical is the antagonist binds to the agonist. So that is not a correct answer. Here phenylephrine and these are non-competitive. Partial, full. So there is no antagonist like partial antagonist. The partial agonist we have, there is no full antagonist or like partial antagonist. So we have full agonist or partial agonist. These are agonists, not antagonists, right? So the correct answer is non-competitive. Take home message is the non-competitive, they decrease maximum efficacy, the same potency. There is no change in the potency or Vmax or ED50. Thank you. I hope you guys learned something. See you in the next video.